Welcome. NSG 515, Study Section 1, Epidemiology of Emergency and Disaster. Introduction. In this study, you shall be discussing about epidemiology of emergency and disaster. You will start by differentiating between disaster, hazard, and emergency. You will focus on a bit on the series of disaster that has occurred in Nigeria. Moving on, you will describe what disaster epidemiologist is. In doing so, you will examine the objectives and purposes of epidemiology in disaster management. Furthermore, you will take a look at the public health surveillance during disaster and its importance. Lastly, you will examine the roles of nurses in disaster and management. Learning outcomes. When you have studied this section, you should be able to differentiate between disaster, emergency, and hazard. Define disaster epidemiology. Describe the public health surveillance. Highlight the roles of nurses during disaster management. What is disaster? When we hear disaster, we all get scared. Should we always be scared or know what to do when it occurs? Before we enter into serious discussion, let us consider what disaster means. A disaster is a natural or man-made hazard resulting in an event of substantial extent causing significant physical damage or destruction, loss of life, or drastic change to the environment. But is disaster the same thing as emergency and hazard? With some emergency are self-evidence, such as a natural disaster which threatens many lives. Many smaller incidents require the subjective opinion of an observer or affected party in order to decide whether it qualifies as an emergency. Now that we have been able to differentiate between emergency and disaster, let us examine what hazard is. Simply put, hazard can be defined as something which may cause harm. Hazard can be prevented from developing into a disaster by human actions. Hence, human failure to introduce appropriate disaster management makes all disasters man-made. Disasters in Nigeria. The development agencies are said to have pointed to the fact that flooding in Nigeria in 2012 was the worst in recent history, having displaced over 1.3 million persons from 30 states in the country and caused untold hardship to the victims, most of them peasant farmers. Daniel 2012. Flooding is one of the major environmental crises one has to contend of within the century. Flooding is defined as a large amount of water covering an area that was usually dried. Olajuyibe et al. 2012. Define flood as a natural hazard like drought and desertification, which occurs as an extreme hydrological runoff event. Flood can simply be defined as a flow of water above the carrying capacity of a channel. In the past decade in Nigeria, thousands of lives and property worth millions of naira have been lost directly or indirectly from flooding every year. It is a natural phenomenon occurring from time to time in all river and natural drainage systems. Flooding and rainstorm, apart from causing destruction to lives and properties, often cause significant damage to the livelihood system of the victim. The impact of floods has been increased due to a number of factors, with rising sea level and increased development on floodplains, etc. Developments on floodplain, etc. Ologorisha 2004. Recurring flood losses have handicapped the economic development of Nigeria and other developing and developed countries. The devastating flood occurrence and its multidimensional impact on the masses have been a great concern to Nigeria and the whole world as a whole. The 2012 flood was believed to have resulted from the combination of Lagdo Dam effect and rainfall intensity. It was excessive water due to heavy rains that forced the Cameroonian government to open the spillways of Lagdo Dam, having sent warnings to Nigeria for the release of the water. About 14 states that border the Nigeria-Benue River were severely affected. The worst affected states include Kogi, Edo, Anambra, and Delta states. This flood incident has been characterized as the most devastating since the last 40 years. Felix Ndidi, 2013. The flood submerged houses, severe transportation routes throughout the affected areas. Overall, an estimate of 1.3 million people was displaced and about 431 people lost their lives. MISNA 2012, NASA 2012. In addition, over 1,525 square kilometers of farmland were destroyed. Conway 2012 described the flood as the worst floods Nigeria has seen in at least half a century, which has led to the death of hundreds of Nigerians, displaced over 1 million of people, and destruction of hundreds of thousands of acres of farmland. Huge swaths of the country were affected, particularly in central, south, and eastern regions, with houses, bridges, and roads devastated. Many refugee camps were overcrowded with little or no aid materials. Although, through the flood, Early Warning Center, Nigeria's Ministry of Environment 2012 issued a forecast of heavy rainfall in the mid-September and warned of potential flooding in some parts of the country, Anambra inclusive. But spatial and synthesized information was not made available. Such information involves the detection of the area extent along the Niger and Benue rivers that is at risk of vulnerable to flooding. It is evident that planners and policymakers lack the required platform for producing such information. This is because reports reveal that the numerous refugee camps which were set up in the presumed safe ground were equally overwhelmed by the flood. In general, flood hazard mapping is a vital component for appropriate land use planning in flood-prone areas. It creates easily read, rapidly accessible charts and maps that can facilitate administrators and planners to identify areas at risk and prioritize their mitigation or response efforts. Disaster statistics for Nigeria. Reports coming from the field also suggest that Nigeria may be under threat of food crisis in 2013, a situation which we are already facing now. Therefore, the international support required is both for the short and long term. Table 1.1 show a breakdown of disaster occurrence from 1980 to 2010. We shall be looking at how to assess the effects of disaster and how to predict future occurrence. This process is referred to as disaster epidemiologists. Disaster epidemiologists. Disaster epidemiology is defined as the use of epidemiology to assess the short and long-term adverse health effects of disaster and to predict consequences of future disasters. It brings together to various topic areas of epidemiology, including acute and communicable disease, environmental health, occupational health, chronic disease, injury, mental health, and behavioral health. Disaster epidemiology provides situational awareness, that is, it provides information that helps us understand what the needs are, plan the response, and gather the appropriate resources. The main objectives of disaster epidemiology are discussed below. Objectives of disaster epidemiology. Among many other things, the main objectives of disaster epidemiology are to prevent or reduce the number of deaths, illness, and injuries caused by disaster, provide timely and accurate health information for decision makers, improve prevention and mitigation strategies for future disasters by collecting information for the future response preparation. Purpose of epidemiological study. We should ask ourselves a pertinent question here. Why the study of epidemiology in importance are highlighted below. 1. It measures the post-disaster health status and basic needs of the affected community. 2. Quickly and effectively deploy response assets and medical care. 3. Prevent additional casualties during response and recovery. 4. Assess levels of healthcare use in the affected communities. 5. Evaluate communicable disease and infection control and prevention efforts. 6. Monitor the safety of relief and recovery workers. 7. Monitor the health conditions in shelters and evacuation centers. Public health surveillance during disaster. During a disaster, it is important to conduct surveillance to determine the extent and scope of the health effects on the affected population. Surveillance is the systematic collection, analysis, and interpretation of deaths, injuries, and illness, which enables public health to track and identify any adverse health effects in the community. It allows us to assess the human health impact of a disaster and evaluate potential problems related to planning and prevention. A common myth is that epidemics are inevitable during a disaster. However, epidemics do not spontaneously occur, and public health surveillance can mitigate the likelihood for outbreaks through early detection and response. Additionally, conducting health surveillance allows for the ability to make informed decisions about action items such as allocating resources, targeting interventions to meet specific needs, and planning future disaster response. While each disaster is different, there are similarities among them, and we can apply knowledge learned from each response to the next disaster. The Disaster Surveillance Work Group (DSWG) brings together experts from across CDC to set standards for data collection, sharing, and reporting during a public health disaster. Through the work of the DSWG, HSB has developed morbidity and mortality surveillance tools and training materials. Importance of public health surveillance. Why is public health surveillance important? Below are a few reasons why we consider surveillance to be important in public health. 1. Serve as an early warning system. Identify public health emergencies. 2. Guide public health policy and strategies. 3. Document impact of an intervention or progress towards specified public health targets or goals. 4. Understand or monitor the epidemiology of a condition to set priorities and guide public health policy and strategies. An effective surveillance system has the following functions. 1. Detection and notification of health events. 2. Collection and consolidation of pertinent data. 3. Investigation and confirmation, epidemiological, clinical, and/or laboratory of cases or outbreaks. Routine analysis and creations of reports. 5. Feedback of information to those providing the data. 6. Feed forward, that is the forwarding of data to more central levels. 7. Reporting data to the next administrative level. From what we have been discussing, let us even assume that there is a disaster. What are your roles as health workers to manage the situation? Disaster management, nurses' role in the community. In the past 2 decades, there have been many natural and man-made disasters all over the world. Natural disasters like floods, earthquakes, cyclones, droughts, and human-made such as terrorist acts, nuclear or chemical war, fires, and industrial accidents. Disaster can significantly lead to a degradation of social and economic progress achieved over decades of initiatives by the people. 80% of countries' geographical area is disaster prone, and the majority of people live at or below the poverty line. For example, in Nigeria, take the case of Boko Haram. The Niger Delta boys and the recent flood that has hit some parts of the country has been devastating. Each disaster brought a great deal of miscarry to the affected population. Where then is the place of nurses in all this? When there is an occurrence of disaster, a nurse is expected to engage in the following activities. Assess the community. The nurse should look out for the local climate conducive for disaster occurrence, past history of disaster in the community, available community disaster plans and resources, personnel available in the community for the disaster plans and management, local agency and organizations involved in the disaster management activities, availability of healthcare facility in the community, etc. Stanhope, 1992. Diagnose community disaster threats. Determine the actual and potential disaster threats, e.g., explosions, mass accidents, floods, etc. Community disaster planning. Develop a disaster plan to prevent or deal with identified disaster threats. Allender 2005. In creating a planning for community disaster, a health worker should 1. Identify local communication system. 2. Identify disaster personnel, including private and professional volunteers, local emergency personnel, agencies, and resources. 3. Identify specific responsibilities for various personnel involved in the disaster plans. Clement Stone 2002. Identify location and accessibility of requirements and supplies. Set up an emergency medical system and chain for activation. Check proper functioning of emergency equipment. Lewis 2007. These plans can be implemented by 1. Focusing on primary prevention activities to prevent occurrence of man-made disaster. Practicing community disaster plans with all personnel. Practice using equipment, obtaining and distributing supplies. After the health worker has been able to implement all these plans, there is need for an evaluation on the effectiveness of the disaster plan. This evaluation can be carried out by performing the following. Critically evaluate all aspects of disaster plan. Evaluate the disaster impact on community and surrounding regions. Evaluate the response of personnel involved in disaster relief efforts. Study section summary. In this study section, you learn that a disaster is a natural or man-made hazard resulting in an event of substantial extent causing significant physical damage or destruction, loss of life, or drastic change to the environment. An emergency is a situation which poses an immediate risk to health, life, property, or environment. Emergency are self-evident, such as a natural disaster which threatens many lives. Many smaller incidents require the subjective opinion of an observer or affected party in order to decide whether it qualifies as an emergency. Disaster epidemiology is the use of epidemiology to assess the short and long-term adverse health effects of disasters and to predict consequences of future disasters. A common myth is that epidemics are inevitable during a disaster. However, epidemics do not spontaneously occur, and public health surveillance can mitigate the likelihood for outbreaks through early detection and response. In the past 2 decades, there have been many natural and man-made disasters all over the world. Natural disasters like floods, earthquakes, cyclones, droughts, and human-made such as terrorist acts, nuclear or chemical war, fires, and industrial accidents. End of study section 1. Thank you.